Welcome back to another episode of the Care2Listen podcast. In this episode, I am joined by Minister Jennifer Whiteside, the Minister of Mental Health and Addictions for British Columbia. Minister Whiteside shares her insights into the work being done in the ministry to support caregivers across BC. We'll touch on topics that include the Overdose Public Health Emergency, building collaboration across all ministries, and supportive inclusive strategies to address the complex mental health challenges across the province. Trigger warning. This podcast discusses some topics that may be triggering for some viewers, including addiction, the ongoing opioid crisis, suicide, and grief and loss. Welcome back to another episode of the Care2Listen podcast. I'm your host, Sean Burke, and today we are recording at a new location, and I'd like to respectfully acknowledge the Songhees and Esquimalt peoples on whose territory we are conducting this podcast on. Joining me today is the Honourable Jennifer Whiteside, the Minister of Mental Health and Addictions in British Columbia, and elected MLA for New Westminster. Welcome to the show, Minister Whiteside.
Hi, Sean. It's a real pleasure to be here. Thanks for having me.
So you're somebody who has held significant roles, which include serving as the former Minister of Education, of Child Care, and working as the chief spokesperson and lead negotiator for the Hospital Employees Union. So someone really qualified today when it comes to talking about what we're here to talk about. And I'd just love to, before we jump into it, get to know a little bit about your backstory and what's brought you into this role. So could you maybe share a little bit, how you have come into this important role?
Sure, Sean. Well, I never really envisioned a political career for myself. I was really very happy and had a really rewarding career working with healthcare workers, which is what I've done for most of my adult life, is as part of being part of the labor movement. And in 2015, I took on the role of essentially the CEO of the Hospital Employees Union. And as the chief spokesperson and chief negotiator, when our government formed government in 2017, we had a really important round of bargaining in 2018, where we reestablished some fundamental health and safety protections for workers. And what I'd say is that I think it was pretty evident heading into the pandemic that we had some real challenges around mental health issues in the workplace in particular, and really just across all sectors. And then in spring 2020, as we saw the pandemic sort of march across the globe, and then have COVID-19 arrive in British Columbia, we knew that was going to have a tremendous impact on every facet of life, and particularly for healthcare workers who were really on the front lines of the pandemic. So for the first 6 months of the pandemic, I spent I spent that time working with government, with employers, really figuring out how to make sure that we supported the healthcare system, supported healthcare workers, and in particular, how we ensured that in long-term care, where vulnerable seniors were the most directly impacted by the COVID-19 pandemic, to make sure that those residents, those seniors, and the healthcare workers who were caring for them were going to be as protected as possible.
Yeah, and we saw new programs that were released through the Care for Caregivers
That's
program.
Right.
Something that your ministry really took a lead and initiative on. This Care2Listen is an extension of that Care for Caregivers, and it continues to grow. So when you were looking at, and I know that this was part of your predecessor who rolled out these programs, but how has your ministry been able to continue the work that's been done since you took on this role?
Yeah, well, it's a funny sort of irony that my friend and neighbor and former colleague in the labor movement, Judy Darcy, who was the first Minister of Mental Health and Addictions and also an MLA for New Westminster, I remember us getting a call from her one day saying, we have this idea about how we think we can provide supports for healthcare workers during this really challenging time, and that was the Care to Speak. That was the peer-to-peer mental health supports for workers, and that came on the heels of work that had been started to be introduced before the pandemic. The mobile workplace kind of urgent response team. And so, there had already been some work being done to try to figure out how to get to healthcare workers who can't always always go to reach out or get to services themselves. And so that really set some important groundwork and provided really important resources to healthcare workers. And then, of course, I made the decision in the later that year when we had an election in 2020 and Judy was retiring. I made the decision to run for the seat because I really believe that this is a time when we have really complex issues to take on in our province, in our country, in our globally as we're experiencing now. And I think there's never been a more important time to have a government that really listens to working people and who will work with them to make their work safer, to make their workplaces better. So that's really something that we're very committed to, and it's why we've really kept on with this work and continued to make these particular investments in building out the workplace hub as well, so that we have digital resources available for not only healthcare workers but really workers across all of the sectors that were really primarily hit by COVID.
And hearing you talk about the challenges and the complexity, and that being one of the passions and motivations for a lot of the work you're doing, oftentimes mental illness it's not just one isolated issue. Mm-hmm. There's many different ministries that are doing great work, and I'm curious through your specific platform. British Columbia was the first Ministry of Mental Health and Addictions to have such a ministry in Canada. And one of that primary focus is to work across all ministries. So when we're talking about complex mental health issues, I'm curious how your team is working together with other ministries to combat some of these challenges.
Yeah, that's a really important question, Sean, because this is kind of a unique ministry in that we don't have legislation that we're kind of assigned to be responsible for. Our budget is really about trying to secure money for programs that other ministries are going to deliver. It really is about leveraging that work across the health ministry, the education and childcare ministry, MCFD, other labor, other ministries who are actually developing implementing the programs. But it's really important to have a ministry that is really focused on what is an incredibly important and complex sort of set of issues that are, as you say, distinct from, have often been thought of as quite distinct from physical health. So we have this sort of separation of our mental health from our physical health, but we really need to be working towards more of an integration, and that's a really strong focus is the work that we're doing with our colleagues in the Ministry of Health, with our health authorities, to really integrate mental health and substance use into the work that they're doing, so that if somebody wherever they're interacting with primary care, if somebody shows up to their family practitioner, or they go to the urgent care center, or wherever they're accessing primary care, they can find a pathway. They can get on a pathway to get the kind of support that they need, because it's not always as straightforward as it is with a broken arm, right? You have a broken arm, you go to the ER, they do an X-ray and get you cast you up so that and then maybe you'll go do some rehab. But it's much more, it can be much more complex with mental health and substance use issues.
And it's really interesting hearing you talk a little bit about the insight into how ministries work together. In particular, I was picking up on the funding allocation and how the funding is allocated. And on some of the conversations we've had previously on the show, we've heard, how come we just don't have more supports when it comes to grieving a loss of having worked with a patient for so long, and then you're expected to kind of just put it behind you and move on to the next patient. I know that there are some supports in place, and we can touch on those in a minute, but I'm curious to take a step back from the actual specifics and learn and understand a bit more how your ministry has allocated funds. Is there a process in which your ministry needs to advocate for more funds, or how does the funding work when it comes to your ministry and getting the resources that you need to deploy the resources that you're hoping to deploy?
Yeah, well, part of it, these are sort of some of the more the alchemy of how government works, sort of behind the scenes. I mean, part of it though is that we have, I mean, of course, we have health authorities providing and delivering mental health and substance use services as part of their sort of their core mandate, and that. Those additional resources that we've secured for particular programs when we know, for example, in 2021, we made a very significant investment specifically for mental health and substance use services. And we've seen the different ways in which health authorities have scaled up those services. And in fact, just last week, I announced some treatment beds that the Vancouver Island Health Authority is funding. And that is a direct result of investments that we've made. And what's important about the way that that program is going to work is that it is completely connected with Island Health. So the referral for an individual who needs treatment will come through Island Health. It will come through the team of doctors who are working with our community partners who have the beds in the communities, and they'll be making a decision about who gets matched to which bed. Island Health will be monitoring the delivery of that care. They'll be evaluating it, monitoring it. So we'll have a much more sort of seamless and much more eyes-on approach to those particular treatment beds, and that's really what we're trying to scale up across the whole province with health authorities, is having again those services really integrated to the work that health authorities are doing. But another really important area that we're working on is child and youth mental health, which is terrifically important because we know how critical it is to be able to intervene upstream with youth. And so this is where our work with at the Education and Childcare Ministry, my colleagues, Minister Singh and Minister Lohr, and Minister Dean in Ministry of Children and Family Development is really important. For example, in regard to the impact of the toxic drug crisis on youth, while we know that there is, we haven't seen increases in substance use disorder when it comes to youth, we have certainly seen much more tragic and dramatic impacts as a result of the toxic drug crisis on youth, such that now toxic drug poisoning is the number one cause of death for youth. And that is a change that has evolved because of the poisoning of the illicit drug supply. And so that really compels that we work collaboratively with education in terms of figuring out how do we talk to youth about drugs and about the risks of substance use in the context of the really terrible and volatile toxic drug poisoning crisis that we're in right now. How do we work with MCFD when we know that 75% of the youth who die from toxic drug poisoning are involved with MCFD? So those are ways in which we're all working together to find answers to find some solutions to those to that part of the crisis.
And no doubt, an extremely difficult and complex situation, problem, crisis. And, unfortunately, we just surpassed 13,000 deaths since this has been declared a public health emergency. So from your perspective, when it comes to that work, that collaboration that's really being done, is there a specific, not solution per se, but strategy that's really being focused on when it comes to addressing some of the challenges that we're seeing and the rate of the increase of deaths that we're seeing?
Yeah, well, I would say that first and foremost, it's important to understand the nature of the emergency that we're in. It's not a public health emergency in the same way that we had sort of the COVID-19 public health emergency, where it was a virus. We knew that we would find a vaccine for it, and we had to implement very dramatic public health measures to keep people safe until we got the protection of vaccines. And you could really see sort of a beginning and a middle and a transformation at the into something different for that particular health emergency. The toxic drug emergency is just a terrifically wicked problem because in part it's driven by a toxic drug supply, which was made so much worse by our experience through COVID. It is a challenge in terms of all of the pillars that we bring to bear on this problem and have historically, from enforcement to prevention, to treatment and to recovery. All of those all of those pillars are really critically important, but really challenging for law enforcement. We're doing everything we can to try to separate people from the toxic drug supply, trying to look at the upstream issues and prevention, particularly around children and youth. But that it has this crisis has so many different antecedents, right? I mean, as many people who experience addiction, like there are so many pathways into addiction, and there have to be all of as many pathways out of it. And so building a system of care for people that provides them with the right support, the right care at the right time, sort of when they need it, for a disease that is a chronic and relapsing disease is really complex. We had a sort of a landscape in this part of our healthcare system that was really underfunded, deregulated, and privatized for much of the 2000s up until we formed government. And so we are trying to knit together all of those threads to form a real net for people. And this is what I this is what I think about every day, is that we really have to have a net for people. And we have to try to make ensure that that the way in which they can access care is as seamless as possible. And so that's really what we're working on, is trying to ensure that people get access to the care that they need in a seamless way as possible.
It sounds very much like meeting people where they're at. And, it can be really difficult because people are at all different stages.
Absolutely.
And in particular in the recovery, like you said, sometimes there's steps forwards, and then, someone might relapse or, go through some of the challenges, and they know the impact not only stays with the individual who's experiencing those challenges, but also to their wider supports. So I'm curious, as we sort of jump back into, what the ministry and what the government of BC has done when it comes to Stop Overdose BC. There's a lot of work that's being done in the province. And in particular, I'm thinking about the recent steps that were taken on January 31st, 2023, where BC decriminalized the use of certain drugs. And I'm curious, from your perspective, what sort of impact or what sort of changes have you seen by taking those steps and those actions?
Well, it's still, I'd say, pretty early days, even though we're almost 10 to 9 months into it now. But I think we anticipated that it would be a slow process of having that change work its way through the system. And the primary objective of decriminalization, which really had been called for by law enforcement, it had been called for by public health, by frontline physicians and nurses who take care of people, who provide care for people who are struggling with addictions. We had a wide range of partners really calling for changing up that relationship between what happens when people who are carrying small amounts of illicit drugs for personal use, and it's really clear that it's personal use. They're not trafficking. Changing that up so that we don't have police officers kind of engaging in a kind of through a criminal justice lens with those individuals. We use any interaction that's going to happen between law enforcement and those individuals as an opportunity to again connect them to care, and through that process work to again push on taking away some of the stigma and fear that's associated with drug use, because we don't want people to be using alone, because it is so risky these days. It is so risky given the toxicity of the drug supply for people to be using alone. We want people to feel like they can reach out. And I just I will never forget talking with Catherine Botchford, whose husband was a journalist and who died of an overdose in their basement. And she didn't know that he was using drugs. Didn't know whether he used them, a handful of times or frequently. And the dramatic impact of that on her, I mean, life changing for her and her family. And the questions around, if you've got a loved one who has died from toxic drug poisoning, you're always going to be wondering, is there something that could have been done different? Could I have reached out in a different way? Should I have done something different? And we don't want any family to feel that, any family to be in that position. So working to, remove the fear and stigma associated with it, so people feel like they can reach out. Because again, you know what to do if you've got a broken arm. You don't necessarily know what to do if you if you have an addiction issue, but you might not even really know that you have an addiction issue. You just may be aware that you have a problem, or you might be concerned about some of your substance use. People need to be able to reach out.
And so back to that healthcare worker who's, feeling overwhelmed or maybe, challenged with some of the unique pressures that they might be facing. If they are using substances to cope with some of those challenges or issues, what would you say to them?
Well, first of all, I just want to say that, healthcare workers have gone so above and beyond and done such incredibly, just extraordinary work, always, but particularly throughout the pandemic. I mean, we would not have survived in the way that we did as a society if we didn't have people showing up every day in hospitals and long-term care facilities, in social service agencies, in taking care of other people and making sure that all of the rest of us had access to the kind of care and support that we need. And we can never forget the incredible contribution that healthcare workers made to getting us all through an unimaginable time for us. I mean, really, kind of a collective existential crisis, something we have not experienced, any of us, in our lifetimes, and that was, for my mother who died last year, but was in her early 90s, and in long-term care, and got COVID and got through COVID. She remembered. Although she didn't live through it, she remembered, the Spanish flu after the First World War. But, this was not something that any of us had lived through. And what healthcare workers did was remarkable. And I understand that the pressures on healthcare workers today are extraordinary. I mean, we talk about being sort of, out of the pandemic. I mean, we're certainly out of the acute phase of the pandemic, but we know that COVID continues to have, a significant impact on our healthcare system. We're in a world now where we want people to stay home when they're sick because we don't want to risk transmission of COVID-19 and other respiratory illnesses, but COVID-19 can still be very, serious for vulnerable populations. So we're in kind of a different world now, and that compounded with the, an interesting fact that we don't necessarily think of in connection with this, but over 200,000 people moved to British Columbia in the last 2 years. We've seen rates of immigration to British Columbia that we have not seen in decades, maybe ever. And that means that all those folks need access to healthcare, to doctors, to education, to all of our our services. And we're working hard to try to catch up our health human resources with that picture. But it's hard these days in healthcare. So I understand that healthcare workers are going through a lot. And I just would strongly encourage healthcare workers to, if there's somebody that they can reach out to talk to in their family, in their workplace, in their union, to do that.
Jumping into a little bit more of, the ministry's Pathway to Hope report, or the update that was recently provided. I'm also going to bring in the In Plain Sight report that was also performed. I'm curious to hear, in that Pathway to Hope report, one of those key pillars for the ministry's strategy was to really have strong Indigenous-led solutions. Yeah. And so I'm curious if you could touch on what your ministry is doing when it comes to supporting more specific Indigenous-led solutions.
Yeah, thanks. That's a really important question. We know that First Nations and Indigenous people are disproportionately impacted by mental health issues and by the toxic drug crisis as well. Indigenous people are 4 times more likely to die from toxic drug poisoning. Indigenous women, 11 times more likely to die from toxic drug poisoning. So, there are many reasons for that, having to do with colonialism, racism, intergenerational trauma, many things that again are specific, particular issues for those populations, and so we understand that it is critically important for Indigenous people to lead their own solutions, and for us to support that. And if there's anything that I really learned in the first couple of months on this on the job in this file is that community really saves lives. But culture really saves lives. Culture really saves lives. And so ensuring that we have culturally, appropriate, culturally led services in place is really key. And so we've been working with, we work directly with nations. We work through the First Nations Health Authority, and we have some programs that are funded and developed in conjunction with the federal government. To provide treatment services for Indigenous people, for First Nations. And in this past budget, we allocated $171 million for Indigenous-led treatment and recovery programs that will look differently across the province, but working really closely with nations on where that goes and what kinds of services get scaled up with that.
And really what I loved hearing about that response too is that it's not a one size fits all, and it's a one size fits one nation approach. And being able to have that self-determination and those communities lead and bring forward some of their own solutions is such a really strong way for communities to lift up and support their community members. So definitely applaud your ministry in that regards. When it comes to a little bit more of a long-term vision, and I think sometimes this might be a little bit of criticism that different governments get from time to time, is it's a little bit more short-sighted. What is your ministry doing from a long-term vision perspective? Yes, there's the importance of dealing right now with the crisis that we're seeing, but what about that long-term solution? Right, this isn't going to be a problem that's fixed overnight. I'm curious what your sort of forward-thinking plan is with your team.
Yeah, I mean, and it is again for me, it really gets back to how we transform our healthcare system to also be always thinking of health and mental health and substance use as part of health as well. And so we laid out our vision in Pathway to Hope, our 10-year strategy on mental health and substance use care. And we're working through, made lots of progress on particularly the preventative side and the upstream services in regard to children and youth, and clearly more work to do there. We've done things like ensure that we have low barrier community counseling resources available for people, again, as a sort of an upstream preventative kind of access to lower barrier services. And then again, it's working with health authorities to really integrate the care and treatment. So for example, St. Paul's right now is working on a sort of a seamless model where an individual would come into the hospital through ER, through their rapid access addiction clinic maybe, and they would get referred to a detox and stabilization bed. They'd be cared for while they're in withdrawal management, and then they'd transition right into treatment. And then from treatment, they transition to an aftercare program, and it would be sort of seamless and all under the auspices of the health authority. And I think it's we are always going to work with community partners. We have very many excellent community partners who deliver services in this space, and making sure that we have the right sort of approach to when the health authority is delivering services, when they're working with community partners to deliver services. That's also a big part of what we're doing right now, because we really have to be building up the evidence. We have to understand what kind of approach to treatment works in certain situations. We know that bed-based treatment works for some people in some circumstances. We also know that outpatient treatment can work. Some people can be supported to detox, for example, successfully at home. They can be in a treatment program, but be supported to do that from home. So, again, kind of meeting people where they're at and having the right kind of service for what they need. That is work that we're engaged in. And really having things like our early psychosis intervention program, which we invested over $58 million a couple of years ago in scaling up and investing in the healthcare providers that we need in order to make sure that that youth, when they are interacting with the healthcare system, if they need support for mental health issues, that they have access to that dedicated program. So there again is it is about working with health authorities and working sort of across the sort of provincial services and regional services, so that just as if you've got a broken arm and you can get care at the hospital, if you're having a mental health issue, that you can go and get the help you need at the hospital. And you may not need hospital-based help. You might need some other kind of help, but we're going to help you figure out what's going on and then get you transitioned to the care that's right for the particular care that you need.
Absolutely. Well, we have certainly covered a lot today, and I know there's tons more questions that I'd love to get to, but I really feel like today we've been able to capture a wide range of topics, and to also just re-emphasize that if you are a healthcare professional and you are struggling or you do need supports, there are platforms, there are services that are available for you. And again, we'll make sure that those are available in the show notes. Very briefly, as we sign off here, I'm curious if there's anything we haven't covered today, or any messages that you'd like to offer to those healthcare practitioners listening today.
Well, again, I want to come back to the extraordinary work that folks are doing on the front lines. I've had a chance to tour the province over the last few months, and I've seen peer outreach workers do incredible work. People who were homeless and lived on the street for a long time, who found their path, found a wellness journey that worked for them, and are now employed by the Interior Health Authority doing outreach, supporting people who are kind of where they were 20 years ago. And it is incredibly moving to see the commitment and the dedication that they bring to that kind of work. I know there are so many workers across our supportive housing sector, for example, who are working with people who have mental health and substance use issues, doing incredible work supporting them. And I think a lot about the street outreach workers who load up backpacks and with wound care supplies and food and granola bars and Ensure and go out and meet people where they're at and provide care for them. And I have been so moved by the incredible compassion of really, again, meeting people where they're at and treating people with the utmost of dignity when they're sometimes at their worst, sometimes having their worst moment, but always being able to find the human value and the dignity in everyone. And I think about that every day. I've had, particular experiences that I've been part of where I have been really, really impacted by just the incredible dignity and sensitivity and compassion that healthcare workers are bringing to their work. But I also know that it takes a toll. You don't do that work without it taking a toll on you. And I really want healthcare workers to know that we've got their back. We brought in presumptive coverage for certain occupations in British Columbia to recognize that there are some jobs that just come with a higher rate of mental health distress than others, and that we need to make sure that the pathway for through WorkSafe is easier for people. So we have the resources that we provide in conjunction with the Canadian Mental Health Association of BC, which as a partnership I'm always deeply grateful for. So there are resources out there, and I really I just want people to take care of themselves because I know it's tough out there.
Absolutely. Well, thank you very much for taking the time today, Minister Whiteside. We really deeply value your insight, your time, your ministries, all the hard work that is going into, trying to make BC a great place to live. And when people are struggling, to recognize that, that happens, and it's okay to put your hand up and to get that support, get that help that you need, because it impacts us all. Whether you're the person struggling with mental illness or you're the person that's supporting.
Yeah.
So we really deeply value your time, your insight, and all the hard work that your ministry is doing. So thank you very much for coming on the show today.
Thank you so much for the conversation, Sean, and shout out to all the healthcare workers out there.
Absolutely. Thanks for listening to this episode. Be sure to visit the links in the show notes for resources and supports from the Care for Caregivers program. If you're interested in sharing your story on the Care2Listen podcast, please reach out to us at careforcaregivers.ca/podcasts. And don't forget to follow us on your favorite podcast platform to be notified when new episodes are released. Thanks again for joining us, and see you next month.